Good evening to all. The 46th medical term that we'll be discussing today is myasthenia gravis. Yes, it is a disease. It's a chronic, that means for a long time, neuromuscular disease. So, why is it a neuromuscular? Because it is affecting or it destroys the neuromuscular junction, that is a synapse between the neurons and the muscle, that is the motor neuron and the muscle. So, what really happens? What is the output of this? Generally, there is a weakness in the voluntary muscles. What are these voluntary muscles that get weakened? The muscles in the bone, attached to the bone, face, throat, diaphragm, and of course the forelimb and the hind limbs, that is the arms and the legs. So, what type of disease category does this belong to? Well, it's an autoimmune disorder. As we all know, if you look at the term autoimmune, the literal meaning is like auto means self, that is a self antigen. Immune is like protection. So the literal meaning gives an idea that it is a way of protecting the self antigen. But if you look at the way the immune system tries to protect is by destroying. So the real meaning is that this disorder causes the immune system to destroy our own self antigen. So, what is the self antigen that is targeted in myasthenia gravis? It is the nicotinic, that is acetylcholine. So, acetylcholine is a neurotransmitter. So, there are antibodies which act against nicotinic ACH, autoantibody. And because of that, this neuromuscular junction region is completely destroyed. So, impulse will not reach the muscle or the effect organ. So there are different types, like class 1 affecting the ocular muscle, that is in the eyes. Class 2, 3, 4, and 5, you can see it causes an overall muscle weakness, but the severity keeps increasing, like mild, moderate, severe, and sort of very severe. Especially the class 5, it affects the muscles related to the breathing, that is the respiratory system. So overall, there is muscle weakness, fatigue, and it affects the eyes, droopy eyelids, blurry vision, difficulty in speaking, swallowing, chewing, facial expressions can be limited, etc. So, how do you diagnose? Of course, you do a blood test to check the autoantibody levels. And of course, there is something called we can check the ACH levels also. Or we do a nerve stimulation test, like by sending electrical signals and checking, how these neurotransmitters are they able to progress the impulse, or any imaging studies to look at the damages, or single fiber electro